Everyone. My name is Marta Davila Garcia, and I will be moderating today's webinar, Fighting the Mom's Penalty in the COVID Era, How to Push Scientific Institutions to Ensure Caregiving Scientists Can Thrive at Work. I am an Associate Professor of Pharmacology at Howard University, a SAGNAS board member, a treasurer, and a proud mother of a 26 and a 13-year-old daughter. Today, we will focus on discussing an issue that many of us are currently facing during this time. Many working parents and caregivers have transitioned to working from home and are expected to work full-time while juggling household and caregiving duties. The phenomenon of women seeing less career advancement, lower pay, and less perceived competence compared to men and child-free peers is called the mom penalty. This penalty affects many, but disproportionately falls upon women, and more specifically, women of color. SAGNAS is proud to co-host today's webinar with 500 women scientists, a grassroots organization whose mission is to serve society by making science open, inclusive, and accessible, and transform society by fighting racism, patriarchy, and oppressive societal norms. 500 Women Scientists has 400 local chapters around the globe, and they work towards their mission by changing the face of science, holding institutions accountable, and building collective power. For our first-time attendees, welcome to SAGNAS. We are an inclusive organization dedicated to achieving true diversity in STEM, where the field, including leadership positions, reflect the demographics of the population as the nation's largest multicultural and multidisciplinary STEM diversity organization in the country. SAGNAS creates spaces where all members, volunteers, partners, and staff feel they belong and can embrace their intersectional identities. Before we introduce our panel, I want to acknowledge the privilege afforded to those of us who are able to work safely from home in stable jobs with our children and other loved ones close by. This luxury is not afforded to healthcare workers around the nation who are working around the clock to care for people struck by the virus, and we first would like to acknowledge and thank them for their work. And I'd like to also acknowledge the tremendous toll that the virus has taken around the world. Joining us, we have an extraordinary panel who will be defining the mom penalty further and introducing ways to mitigate the professional hurdles it creates. With us today, we have Dr. Joy Gaston-Gales, a professor and university faculty scholar at North Carolina State University. Her research focuses on women and underrepresented people of color in STEM fields. Dr. Gales is a faculty coach and campus workshop facilitator for the National Center for Faculty Development and Diversity. She's also an at-large board member for the Association for the Study of Higher Education. Dr. Jessica Metcalf is an associate professor of the Department of Animal Sciences at Colorado State University, a member of the 500 Women Scientists Advisory Board, and a CIFAR Global Scholar. Dr. Josephine Rodriguez, who is an associate professor of biology at University of Virginia College at Wise, a co-investigator of PI with NSF Advanced Partnership Council of Public Liberal Arts College, partnering and liaising across the nation, and an alumni of the 210 Linton Poudry SAGNAS Leadership Institute. We will open up with questions for the panel, and there will be time for Q&A towards the end of the webinar. Please feel free to submit your typed questions via the Q&A feature, and please remember to be respectful of everyone in the chat. Okay, so here we are. Hi, everybody. So our first question is going to be directed to Dr. Metcalfe. Dr. Metcalfe, what has been the impact so far of the pandemic on women and others with caregiving responsibilities?
Hi, and thank you for having me as a panelist on this webinar today. So certainly the pandemic has affected the productivity of scientists for many reasons, and has been particularly challenging for people whose caregiving support has been lost. Reliable childcare has allowed women to succeed in the workplace and has allowed us to begin addressing the racial and gender inequities in the STEM fields. But with COVID, we risk losing some of these hard-fought gains that we've had. So data are limited at this point, but one published study found that the largest changes in research time were for scientists with young children. And overall, the most affected were women with young children in the bench-heavy biological sciences. There's also some evidence that women are submitting fewer publications. Although I want to acknowledge that there are ethical and methodological issues with research which infer gender from author names. We don't yet know the effect on grant proposal submissions, but we're concerned about a gendered effect on early career postdoctoral and faculty fellowships, particularly. And the US National Academy of Sciences will soon launch a study on the pandemic's effect on female scientists' careers. So from that, hopefully we'll learn more about the effects of COVID. So this gender effect, though, it's not a surprise as research shows that women generally spend more time caregiving and managing domestic responsibilities. This doesn't discount the effect on men caregivers, but the effect is disproportionate across gender. And the effects will also likely be greater for intersecting marginalized groups such as women of color. At many institutions, such as mine at Colorado State University, we already know that gender disparities exist across faculty and other employee groups. And also a recent report showed that female scientists in Australia are more likely to be in short-term jobs that will be cut as part of COVID economic setbacks. So overall, we're concerned that COVID-19 is going to exacerbate the persistent gender gap that already exists in science, that many of us, including leadership at institutions, funding agencies, and elsewhere, have been working really hard to reverse.
Thank you so much. So before we go into, how can we fix all this? Dr. Rodriguez, can you tell us, as the pandemic goes on, what additional impact and long-term consequences might we anticipate?
Okay, so, well, first, thank you for having me on this panel. And so as for long-term consequences, I'm in a position as a co-PI for an NSF Advanced to actually be able to think about these things. And the co-PI, I'm a co-PI of a team with multiple PIs from multiple COPLAC, which is the Council of Public Liberal Arts and Liberal Arts Colleges. And we presented last month to the COPLAC leadership at the annual meeting. And this is also extending on what Dr. Metcalfe was talking about. So we gathered some of the preliminary research that's already been out there. And we cited a paper, for example, written by Yolanda Hutchinson, "The Pandemic Risks Wiping Out Hard-Won Gains by Women in STEM." And she wrote about the crisis and how there's documented double burden of women working from home and managing remote learning for children. So it's the employers need to be vigilant on gender equity. There was another paper published by Stadnick and Black it was an opinion piece in hydrological processes. And they wrote that, again, we all need to be cautious post-pandemic because there's this potential for fewer females in leadership positions and fewer of those really important female voices at the table, and all of which is going to increase that gap in gender equity. And then another paper that, again, it's not, I want to say predicting the future, but it's kind of giving you a glimpse of where this can go, was written by Goodwin and Michnick. Their title was STEM Equity and Inclusion Uninterrupted. And they're also advance awardees. And they noted that understanding how the pandemic will differentially impact STEM women, particularly women of color, will be key for institutional leaders to identify and deliver equitable and inclusive solutions in the wake of this crisis. So that actually was one of the few publications we found that that talked about the intersection of COVID-19 and some of the increased racial tensions in our country. That's a different webinar, but nonetheless, it's something that people have to be thinking about. And also, I did read somewhere that when people look back at publication records from 2020, probably we're going to have significantly fewer women on those publications. So fortunately, we have platforms like this webinar, where we can start putting our heads together to try to think about solutions so we don't lose some of those gains we've made in gender equity in STEM fields.
That's absolutely right. So this is for the 4 panelists, but I'm going to go to Dr. Metcalf. What do you think we need on an institutional level, and how do we get leadership involved?
Thanks. Yeah, this is a really important question. So I think the most important point is for institutions to have comprehensive plans that provide flexibility and transparencies to employee caregivers. On the 500 Women Scientists website, and as part of the resources that people will get, participants will get, we provide recommendations for university leaders, PIs, and employers as part of a short policy position document. And so overall, I think there's a need for acute action, so such as flexibility on hours, deadlines, and teaching relief, but also long-term needs, such as revising evaluation methods and other ways to make sure that we don't see this COVID effect sort of 5 or 10 years down the line, looking back to publication records at 2020, 2021. But getting the attention of leadership can be really challenging. At Colorado State University, I'm part of a council for gender equity on the faculty, which reports to the president's office. And this has been a really effective means for us to keep pressure on leadership about these issues. And we've had a really great response. Now, I realize though, not everyone, particularly, especially grad students or postdocs, have that type of avenue. But I would say overall, sending letters or pressure from part of a committee on campus, whether it's a student group, could be really, whether it's your SACNAS chapter, could be really effective. And to relieve some of the time burden of doing this, 500 Women Scientists has actually provided a template letter if you're interested in sending something like this to your leadership. And that'll be part of the resources for the participants. If your university or institution has a pandemic response team, possibly also trying to have representation on that could be an effective means. I also think that feedback from the community is important. And so pushing leadership to provide like institutional surveys to try to understand what are the needs of the communities, because it's going to be different in different types of institutions and locations. But finally, also leadership needs to be cognizant of unintended consequences. Like, for example, many universities have gone to automatic tenure track exemption, extensions. Some are exempt out, some are exempt in. And these have been shown that they can disadvantage women faculty, so they do need to be approached carefully and thoughtfully. And I'll stop there because I'm sure the other panelists also have quite a bit to say on this. Thank you.
Anything else from our panelists, Dr. Rodriguez or Dr. Gales? Would you like to chime in as to what kind of activities or what can we make our institutions do or be aware of, or how can we make them, be a part of the solutions? How can we get them involved?
Yes, I'm going to talk about some solutions in my next question, but I think the more that they know and understand what exactly the issues are, I know at my institution it's effective when faculty form coalitions and not just go one at a time, but go collectively. Their voices are heard much more, because it's not just an issue that affects one, but it's an issue that affects many. And whenever you link it to things like retention and productivity, you tend to get more of a response because, again, when you talk about senior level administrators, that's their goal. They spend a lot of money to get you there, and it would be a loss, a great loss to lose you. And so retention is key. And if any problem that you have, if you can link it to goals that are important to them, which is retaining faculty, then I think the response will be better. And you may have to, bring it to their attention more than once because one time won't get it. I think they need to hear it over and over and over from as many different angles as you can think of.
Yeah, that's absolutely right. Dr. Rodriguez, I know you want to say something too.
So I was just going to add, so for the advanced project that I'm on, we obviously NSF Advance is to address gender equity in STEM fields, and the program officer actually encouraged us we were allowed to have some flexibility. So we were encouraged to think about how COVID-19 closures are going to impact women, and we were then allowed to modify the type of faculty data that we could collect, and we were allowed to modify our survey instruments so we can gather more information on the impacts of COVID-19 on STEM faculty. But I just wanted to share a little bit on the approach that Advance is using. It's a top-down and bottom-up approach. Top-down is specific training for the COPLAC leadership and specifically given at the COPLAC annual meeting. And the bottom-up approach are these affinity groups where a lot of times a woman in a STEM field will be the only woman in her building or in her department. So what these affinity groups can offer is a network opportunity, and also it'll help offset some of the isolation that sometimes women feel when they're the only woman, for example, that's a chemist in their building. So my point there is that we are going to be addressing these impacts of COVID-19 in those working groups, and also making sure that the leadership at the COPLAC institutions understands these issues, because the leadership at these institutions, not necessarily the same population as the women that are trying to get tenure and also trying to take care of young children at these institutions. So I just wanted to add that because it's a potential model that other institutions could use in trying to offset some of these COVID-19 impacts.
Absolutely. We all need a team, a network, so that we can actually move forward on this. Dr. Gills, how can we support women scientists in the long-term recovery? How can we avoid COVID career effect? 10 years from now, what's going to be, the likelihood that we're going to be way behind?
Yeah, so, given the challenges of working from home and caring for others, whether it's kids or parents or others that need your attention because you don't have the resources that you had because of COVID, there are going to be some consequences. Some we can predict, others we won't be able to predict. And so we have to be really thoughtful about what we're doing now to kind of offset some of that in the future. And we won't be able to do it all because, again, we can't anticipate everything, all the ways in which this will affect our lives 10 years from now. But I do think that we have some options now in terms of how we, maintain our sanity and productivity in the midst of it all. And so, but I think institutions should be very proactive and not, we're very much a reactive kind of discipline. We need to be proactive though, particularly when it comes to junior scholars. I think we need to do a better job of understanding exactly how COVID is complicating the lives of women scientists, particularly for this context, but everybody's lives, and particularly those who are caring for younger children, as the panelists have already said prior to me talking. But I think we like conversations like this are super important where we are beginning to articulate some of that. But I think there needs to be more, because I'm a firm believer that solutions to all problems are embedded within the problem itself. But if we don't talk about it, then we don't have a clear understanding of what the problem is. And then it becomes harder to think about how to solve those problems because we are silencing them or not giving space, or, you know, the old mantra, just suck it up and do your work. Like that goes, all of that goes out of the window, because these are certainly unprecedented times. And you know, whenever I have to do a talk like this, sometimes I go to Twitter or Facebook and I just ask people, like, what is this like for you? What are you experiencing? And some of the responses I got, people are really struggling. And so we need to have solutions now so that we can maybe soften the effect 10 years from now. And so I think, you know, like productivity, I think is a challenge. It was a challenge before COVID, right? And it's certainly a challenge now in terms of how do we do all the things, particularly regarding faculty life and in academia. Like, it's hard enough already to do the service, the teaching, and the research. Now, on top of the fact that you have to care for young children, parents in the home, like, it becomes even more of a challenge. And it's a challenge for me too. I have two small, not very small. I mean, they're very independent, given that they're 11 and 15. They can do a lot of things independently. But in one of my roles as a faculty coach, I just wrapped up the summer session. I had 4 amazing African-American or Black women in my group, and one of them had very small children, and it's very hard to figure out, you know, how do I entertain them without causing harm, right? I can't sit them in front of a TV all day, every day, and expect good things to come from that down the road. So there's some real challenges, but what I learned from my, just thinking about the way in which this penalty is showing up for folks in real life, some creative, I mean, we're gonna have to think outside the box in terms of creative solutions. Like, people need funding to outsource childcare so that I can do my work. And so, you know, how can universities, how can institutions, how can workplaces think about how to provide funding for families to provide childcare, and not just childcare, but, you know, I'm fortunate that my kids adapt well to an online learning environment, but other parents may not be as fortunate, where they actually may need assistance or extra tutoring to make sure that they are learning within that kind of environment, because that might not fit everybody or every child's learning style. So, you know, one of the ideas that I had, can we redistribute travel funds? Because nobody's traveling anywhere for the, you know, immediate future. How can we think about how to redistribute those funds so that faculty can use that funding to provide childcare, so that it can, again, soften some of the effects. I can maintain, it may not be the same level of productivity, but productivity in the midst of this challenge. So that's one solution. You know, many of you know that I have I do a lot of work with the National Center for Faculty Development and Diversity, and that's an awesome resource. And so when I talked about going to administration in groups, you know, forming a coalition and, you know, marching to the provost office and say, hey, we need an institutional membership so that we can get the kind of professional development that we need. And again, I just finished this group. It was very interesting to coach them through the Faculty Success Program in the midst of COVID. And I can't tell you how proud I am of the fact that the Faculty Success Program, in a way, gave them an anchor. And so while their productivity may not have looked the same as if, you know, COVID were not an issue, but it still gave them an anchor, that they were able to still prioritize their research and their writing, the things that they know are going to matter in terms of their long-term success and in career advancement. They were still able to maintain it. And that, you know, and that's the beauty of the skills and the techniques that you learn through the Faculty Success Program, is that, you know, even in the midst of the challenges, you can hold on to or prioritize your research and your writing in a way that, you know, I don't think I could if I didn't have that kind of supportive community and a coach who checked in with me and gave me a sense of accountability. And it mattered. And at the end, you know, today was our last call for the summer. And even in the midst of COVID, each of them were able to name something that they completed that will matter in terms of their tenure, promotion, career advancement. So that is a thing that institutions can do. NCFDD is the largest faculty development center in the country. And so we're celebrating 10 years this year. But in addition to the Faculty Success Program, there are webinars that, you know, faculty can engage in on their own time to give them skills, to give them ideas and techniques that they can practice and keep practicing so that they get better at some of the things that they may not learn in graduate school about how to be an academic or how to approach faculty life in a way that in a way where you feel like you're thriving. You're not just surviving. I feel like we're all kind of surviving now, but, you know, and have a life, because that's the counterintuitive part of it. Like, part of this struggle with COVID is that it's given us time. You know, that's the other thing we talked about, which was weird today. All of them said something about gifts from COVID. And I said, gifts? You know, I think COVID is like the devil reincarnated, but they talked about gifts. I mean, and many of them talked about the time that they now have to focus on things that they were not able to focus on because they now have the time to sit and focus. You know, and so I think, you know, if we look hard enough, there are some ways that we can use this time and space to make our institutions better, to help institutions think about how to better support faculty through these challenging times. The other note I have here is that, you know, we really have to rethink our standards for tenure and promotion, the rules and regulations. And I think Dr. Rodriguez mentioned this earlier, like, they're going to, I mean, thinking about 10 years from now, there are going to be gaps. And one of the ways in which we evaluate faculty is, you know, the consistency of productivity. So they don't want to see any gaps. So if I didn't do anything from, you know, 2020 to 2023, you know, that may hurt me in the long run. Whereas we can't employ those same kinds of metrics when we evaluate people post-COVID, because there are going to be gaps, particularly for women and faculty who have a large responsibility for caring for others, whether it's parents, children, et cetera, during these times. And particularly if they have experienced, you know, God forbid, a death in relation, like, that is an emotional thing that we can't just gloss over. We can't just keep going as if something significant didn't happen. And so we have to think about that, and how do we care for each other as colleagues when it comes time for evaluating tenure and promotion post-COVID. And so, so those are just some thoughts that I have, but we're going to have to really be creative and really think about, you know, what needs to change and how it might change, because there are definitely going to be some long-term effects from this pandemic.
Thank you. Yeah, so it's thank you for saying that. I think you have a ton of really great ideas, and it's also very important to always remember to check on our mental health. That's the first thing that we actually all need to do during these times. We have received actually several very good questions from registered, so I'm going to go ahead and read some of them, and I would like for the full panel to answer any of these questions. Maren Brady asked, what are specific actions administrators at universities can take to support faculty mothers? I think that you mentioned some of them, but if we could just, you know, say 1, 2, 3, 4. One of them was, you know, create some of these affinity groups. What others can you just list? Any of you?
So I would also say a listening session. Because some, you know, I spend a lot of time going around pre-COVID, talking to administrators, and it's amazing. They forget, you know, what it was like to be a faculty member. And sometimes they just need to be reminded. And so listening sessions to actually hear what some folks are experiencing in regards to how COVID is affecting their life and their productivity.
Yeah, thank you. Anything else that you guys can think the institutions can actually do, the administrators of institutions can do? Other than have a town hall meeting?
So I'm in no way advocating ever for lower standards for scholarship and productivity, but Dr. Gales and I were talking prior to the start that we went live, and I believe there is a COPLEC institution. I don't remember which one, but it's on the other side of the Mississippi. That's all I remember. And they are being more creative on what counts for scholarship. So for example, pre-COVID, maybe something like this panel would just be service. But post-COVID, they would look at something like this panel, participation on this panel, as, okay, well let's consider that some sort of scholarship. So being more creative. Obviously never would advocate for lowering standards, but being more creative in what constitutes scholarship is something I hope there's administrators out there and that I need to lunge at the computer, but that hear that. And I have a 5-year-old, and she is bribed with ice cream and iPad, and that's why she's not bursting in here. And I'm an entomologist. I can't do the same kinds of entomology research I could normally do, but I'm doing other things like this panel. So I hope that there are administrators that look at something like this panel, like this service on this panel as scholarship and not just service.
Very good, thank you. All right, Genevieve Halliburton asked, what could research funders do to support this work? I'm guessing that she's a funder.
Yeah, so I'll take a shot at this one. So I think this is a really great question, and I hope funding agencies are already having these conversations or started these conversations. Just with institutions, I think flexibility, transparency are really key, because data is showing that women with young children are among those experiencing the greatest research reduction. We're particularly concerned with the early career fellowship awards. And these are really important for building career, for getting tenure, for a number of things, whether it's a postdoc helping you get a tenure track position or an early career faculty award. So for example, yesterday, 500 women scientists, we sent a letter to NSF asking them to delay their deadline for their prestigious career award. They had previously delayed it 2 weeks due to COVID, but the deadline's next week. And this coincides with many parents having no childcare for 6 months, and they're busy trying to get their classes online for the start of the semester in a couple weeks. And so the concern is there's going to be much fewer women applicants for these types of awards this year. We did get a no. So, but I think starting these conversations and trying to push funding agencies to consider, the timing of their deadlines and what kind of flexibility they can have is certainly a good start. And if anyone's interested, please retweet our tweets to NSF online.
Thank you. Mo Holt asks, do you have any ideas for how to get ahead of the mom penalty for women of color who are planning to having children? So thinking ahead, if this COVID pandemic ends up, going all the way through 2021, there has to be some long-term change that we have to start thinking about and putting it in bullet points to our administrators.
So thinking ahead trying to get ahead the penalty and knowing that you want to be a mother someday, I saw that question last night and I was thinking about it. Start building your networks now. So you might be the only chemist in your building that's a female, or the one of 2 biologists in the county. So you start building your networks now, those support networks now, because you probably are in isolation now as maybe the only female in your department. Start building those networks now. I was lucky that, I was asked to be on the advance before COVID, so pre-COVID. But as for building those support networks, I'll put a plug in for SECNIS. That has been the most valuable networking opportunity. I've been involved for 10 years, and I'm on this list of the alumni from the Leadership Institute, and you feel like you're supported, and you feel like you have a support network, and you have people that understand you and support you. So if you're not already a member, I would suggest becoming a member.
I'll add to that and say, I see things coming through the chat, and I agree that these were issues before COVID. And so COVID is just making matters that were already bad worse. So I do share that sentiment, but I am of the mindset, if I had kind of like the field of dreams mentality, if you build it, they will come. And so a lot of times in areas where I feel like I need support and there aren't support systems, I figure out a way to create them for myself, and bring other people along, and everybody benefits along the way. So one I'll share quickly is that I felt like I needed more accountability for my writing and my research. And so I looked across my college and said, I need about 7 friends who can do this with me. And we formed a group, an accountability group. And that group has been in place for about 7 years now. And like 3 of us have advanced, or 2 of us have advanced to full professor. Just about everybody who came in as an assistant professor was promoted. And now I kind of use it as a way to mentor new faculty in a group setting. And so, you have to give some thought to what is it that I need if I want to have a family, and then how can I get it? And if I can't get it, if it's not already in existence, how can I create it? And so that's just one example that I'll share.
Thank you. So I'm going to read some of the questions that are coming through the chat. I'm looking for questions. I have had to work away from my doctoral program due to the lack in childcare and understanding from faculty at the program. How do I stay in biomedical sciences and not lose everything I have worked for?
I was just going to say, communication is going to be key. And so again, I think this COVID situation and all the things tied into it has a way of making us, particularly as women, feel guilty or shameful about what's happening to us in the midst of it. And I'm going to encourage you not to do that, but to voice and articulate what you're experiencing, because if you let it fester in silence, nothing will happen. You have a better chance of finding a solution if you share and participate in conversations like this, where you can get ideas and support for helping you think through how to navigate it, because all doesn't have to be lost, but it is going to take some communication, some thought, some planning, so that you can put together a system or a way that you can, do your program. It may be slowing it down, but the goal is to complete it, and that may look different than what you had envisioned pre-COVID. But all doesn't have to be lost. We just may have to reframe how we think about some things, and also we have to communicate and keep talking about how this pandemic is affecting us, because if we're silent, then that's where the real danger lies. When you don't say anything about things that are happening to you, you have a way of becoming subject to it, meaning you normalize it and then goals don't get met, you drop out and do all the things that you don't want to do. But articulating it, the more you share, the more you may find solutions and other ways of approaching it where you can salvage and still complete your goal. And I think that I know it's hard to do, and so I'm not I don't want to dismiss the fact that it's hard to push past that, but I think that that's the first step.
Yeah. Also, don't feel that you're alone. I mean, I'm sure that a lot of people, a lot of graduate students are going through that. A lot of postdocs are going through that. A lot of faculty are going through that. So, make a network of people that are in your institution to help you navigate through what is going to be, the steps moving forward. And don't give up. I think you can do a lot of things. Do not step away from your doctorate. You will be able to manage it. Any other suggestions from the panel? All right, let me see if I'm looking for other questions. Do you have ideas for how student mothers can advocate for themselves in general and in COVID times? It feels like most or all of the advocacy for supporting mothers in academia happens at the faculty level and forgets about student moms. So once again, students having to deal with this particular issue. And I would say you have to find yourself a network of faculty and other students as well. Any other ideas while I'm looking for more questions here?
Yeah, your graduate student association can be a powerful arm. I know at NC State, graduate students didn't have health insurance for a long time, which is unfathomable. But, they took it up as an issue. They brought it to the provost, and now they have health insurance as a part of their tuition waiver. And so using associations and groups and organizations like that to move a cause forward can be pretty powerful, because if it's happening to you, 9 times out of 10 it's happening to other graduate students as well. And I think there's a lot of power in a collective voice, again, particularly if you can put it in the language that administration understands. Like, you recruited us, you brought us here. It's also your responsibility to make sure that we can, remove barriers that get in the way of us doing what we came here to do.
Yeah. Yes, go ahead, Dr. Metcalfe.
I'll just follow up a little bit. I mean, I think that's exactly right. And one thing we haven't really talked about, and I know it can be a challenge, but can be effective for leaders, getting the attention of leadership and administration, is also through social media, which of course you may personally not want to do because you don't want to expose yourself to potential repercussions. But again, if you have a champion, whether it's a SACNAS chapter or some other organization, 500 Women Scientists, we do this a lot. We try to pressure through social media to accomplish something. That is another route where that can definitely get the attention of leadership and administration.
Yeah, I have another question. It says some universities have been reaching out to faculty to ask how they can best support parents with young children. They have offered on-site childcare options, but the problem is that if we don't feel safe expanding the exposure of our household, the solutions fall short. What additional support should universities and our faculty members pursue?
First, I just want to follow up on there's some comments in about faculty absolutely should also advocate for students. And, going all the way up from student, postdoc, early career faculty, finding champions that feel more comfortable and have the connections to advocate is really important. And we are out there. So, some people I know may not feel comfortable trying to reach out in those ways, but it is something that I would encourage students particularly to think about as well. Sorry, what was the new question?
Question was about childcare. When some universities are offering to pay for at-home childcare, but some people don't want to bring in somebody from the outside into their household because of safety reasons. How else can you ask the institution to help you with childcare?
That kind of goes back to the point that I made prior to, if some funds that were used for something else like travel could be redirected to, help folks with childcare who have childcare responsibilities. And I don't, like that's a good question. I mean, we really have to be creative in terms of how we think about childcare in the midst of COVID. And so I know some campuses have childcare facilities, and people aren't comfortable, bringing children to those facilities. But, how can we do that or get people to come to our homes safely? Is there a way to do that? I don't have an answer, and I just have to keep thinking creatively about, how can we get support? I know some daycare workers are out of work because of COVID, and daycares having to shut down. And, when they reopen, not everybody gets hired back. I know some colleagues have actually hired those folks to come into their home, but I know that that takes money. And so, but again, you won't know until you ask. And the answer may not be all the way no. It may not be exactly what you asked for. Maybe there's a middle ground, but we have to get comfortable asking for what we need, and figuring out a solution that works for everybody. Because on the other hand, I know that universities are experiencing budget cuts and anticipating cuts, as somebody mentioned in the chat. But even still, there are ways. You just have to be creative about figuring out what those opportunities might be.
How about creating cooperatives between maybe close friends that have not been exposed to the virus, or even within colleagues from work to find creative ways of working 3 days a week you, 3 days a week me, and
right. So it's like
sharing the responsibility and the burden.
In-home carpool, but it's in the house and not in the car, where I bring my kids to you and rotate. But again, I mean, that's so sensitive because everybody has to kind of be on the same page, where we're hunkering down in place and nobody is doing anything that will put them at risk for getting COVID. But something like that could work, but it would have to be a super tight agreement, I think.
Yeah. So if anybody of the people that are actually joining us has any good ideas, I would suggest and plead with you to put them on the chat so that we can then, find solutions and ways in which we can actually help all of you. And we will put that also on the web as a resource. Go ahead, Dr. Metcalfe.
Yeah, I think what you're saying is exactly right, that we don't know the answers to this childcare issue right now, right? So we're trying to piece together some answers, and they're not going to work for everyone. And this is really challenging. And I have empathy for everybody who's joining us today and the challenges that you're going through. And someone I just saw pop up on the chat said that an advisor or advisor's wife or something took a TA responsibility from a working mother. And I think that, thinking about for your own personal case, what is your most challenging thing that you are gonna experience in the upcoming semester, and is there some way for you to get out of it? Don't just assume that because you teach this course and you're the only one who teaches it, there's no option. Let's start thinking and talking about how we can create an option, kind of what Dr. Gale is talking about, these creative approaches. Don't assume doors are shut. Let's try to open them.
Yeah, you made me think of something else, Dr. Metcalf. I think we're talking about, okay, how do we deal with the children? Where maybe we should talking about how do we deal with the work. And
Yeah.
so I want to take care of my kids. I want to make sure that they are learning. That's a priority to me. You know, how do I reduce or get some of this work off of my plate? So maybe give me a TA to help me with the grading so that I can spend more time with my family or spend more time in those caregiving roles. And so I think institutions can do things like that. I think it solves a lot of issues. It reduces some of the workload from the faculty perspective, but it also gives students an opportunity who need support. Like they need the financial piece that comes along with being a TA and the experience of teaching and doing some of that. So, you know, while we're thinking about creative solutions for childcare, we also need to be, you know, considering creative solutions for taking 2 hours a day per week off of my plate so that I can take those 2 hours and, you know, spend time with my kids to make sure that they are keeping up and learning. And for us in North Carolina, you know, most of our children will be learning from home at least through January.
Yeah, there actually in a lot of states, I know that that's going to be the case. I have a question here. It says, are there any tips or recommendations regarding what a postdoc as myself, who has two children to homeschool, can do over the next year? Parceling your time, making sure you have a good, you know, slot of time for your children, slot of time for your work. What do you suggest, Doc?
Well, when I was a postdoc, I felt there was a lot of stress. It felt like a full-time job trying to look for your next full-time job after the postdoc was done. If you could get assistance with some of your professional documents. So for example, if you're applying for a tenure track position, you're going to need a teaching statement, a research statement. If you can get help with that and someone to help maybe with your job talk or your other application materials. And I don't know, again, this is exactly like for example, if you were in a network, or even if it's the Academic Moms Facebook group, any type of network, you could just kind of throw that out there, and there's going to be people who want to help. And I think what happens is that a lot of us realize how lucky we are, and then a lot of us want to help. So I mean, if there's someone who wants, for example, if you're out there and you want to teach at a liberal arts school and you need a teaching statement, I will help you. You can send that to me, and I will help you craft that statement. So hopefully I don't get 1,000 emails, but I do want to help. I do want to help in that way.
So how do you compartmentalize your time? You know, if you have to work from home, how do you compartmentalize your time between your job and your child? Your child's need, you know, they're going to be in school, right? And you have to help them with homework. How do you deal with that?
So it's for me personally, it's difficult, but I have fortunately my husband is fantastic, and he's always helped me. You do have to lower your standards for the cleanliness in your home, lower standards in what you eat sometimes. Like I've had some cardboard pizza, and that's just what I have time for. And so my point there is that I don't have any like tangible tips, but I'm very fortunate that I have a network, and I have people that were willing to help me. And then in turn, I hope I'm willing to help others. So in terms of making it work with my daughter, it is, my day is very like, it's in these chunks. So it's like 30 minutes for work, 30 minutes for Piper, 30 minutes for work, 30 minutes for Piper. But that works for me, and that may not work for everyone else.
Dr. Metcalfe?
Yeah, I just wanted to make one point related to this discussion, particularly with this concern for early career parents and moms. Earlier, there's like, what can the funding agencies do? And I think, you know, as much as possible, providing extension on funding, so that, for example, if you're a grad student mom, or an undergrad student mom, or a postdoc mom, and you want to have the choice to be able to be home with your kids through this fall semester, what are the options for, taking a pause and extending the funding, so that you're not then trying to do, a year's worth of work in 7 months. Can the funding agencies refocus some of their money to extending awards that already exist as well?
It says, I think one thing that has not been discussed about childcare solutions is thoughts on safety for folks with immunocompromised kids who cannot, unfortunately, solve the issues with money.
Yeah, that's going to take that's another layer of creativity. I mean, because you're right, you can't solve, those are not issues that you can solve with money. Like, their safety and their well-being, like, trumps everything. Because, if they are exposed, then it could have dire consequences. And so, we're really going to have to be creative. And, I'll kind of go back. I've been kind of reading the chat as well to help you keep up with the questions, but there are a lot of good thoughts coming through, even for, single parent. I am one of those. I'm divorced. I have 2 kids. I co-parent, but it's still, it's not, I don't use the term single parent because I want to be sensitive to the fact that I do have help. In that, I co-parent, but it's another layer of the challenge, right? And so the one thing I will say that hasn't been said, and I know we're coming on time, is that I can't emphasize how important self-care is right now. Because if you don't take care of yourself, then you won't be any good to anyone else, let alone yourself or your family. And so you have to prioritize doing things that you need to keep yourself healthy. And when I do that, like my self-care involves meditation, running or walking outside. And I can't say how many times that I come up with solutions to my problems in the midst of COVID when I'm doing things that have nothing to do with productivity or getting children to do what I want them to do. The solutions come when I take time out for myself and prioritize my self-care and my well-being. And then, it helps me stay calm. It helps me, keep an even keel so that I can think. And when I can think, then I can be creative in figuring out, oh gosh, how am I going to deal with the fact that all 3 of us have to be in 3 different places at the same time?
Yeah.
And yeah.
Unfortunately, we're going to have to wrap up. I'm sorry. So to conclude, I want to thank everyone for submitting great questions and for joining us today. Thank you, Joy, Jessica, and Josephine for your time and your expertise. Thank you to Gretchen Goldman from 500 Women Scientists. She's a board member, and for her tremendous help organizing this webinar behind the scenes. And thank you all, the participants. We really appreciate you being here with us. We appreciate all your questions. Sorry that we could not get to all of them today, but hopefully in the future we will be able to address some of these issues with you. Okay. So we will put and post some of our resources that we talked about during the webinar today. And you will be able to access this webinar either through YouTube or through the SACNAS library of webinars, okay? A big thank to the 500 Women Scientists in general for co-hosting this webinar. To learn more about 500 Women Scientists, please visit 500womenscientists.org. To access more of SACNAS webinars, become a member, or simply to learn more about our inclusive community, please visit sacnas.org. Again, thank you all and have a wonderful day.